Hello and welcome to Noted. I'm Lakshmi Karthanath. On this edition of Noted, we're going to meet up with a very special person. He has just won an interesting title. He is Dr. Ahmed Shahrabani, and he specializes in acute medicine, but also he's an entrepreneur. That's what makes this all an interesting conversation. He's a winner of 30 under 30 Euro class of 2021. Let's meet him and find out more from him. So congratulations,
Thank you
Dr.
very
Ahmed.
much, and thank you for the introduction. It's very, very kind. It's good to meet you, and thanks for having me.
Thank you very much, and welcome to Oman Observer and Noted program. In Noted, we would love to know, what makes a person special and extraordinary, and the work you are actually doing. Dr. Ahmed, you are currently an entrepreneur at the same time a practicing doctor.
Yes, yeah, no. So no, a little bit about me, very, very quickly. I'm an Omani, so was born in Muscat, grew up in Oman, went to the British school, and then moved over to the UK for medical school. I trained in Sheffield, and then I did my foundation year medical work in South London and Surrey. And then a lot of life basically happened between then and now. So I now am the co-founder of a company called Locum's Nest. So that's my kind of Monday through Friday work. And over the weekends, I work on the COVID-19 units at my local hospital as a acute medical physician as well. So yeah, no, it's a busy time, but a good time.
Yes, it is also nice to know you are excelling in entrepreneurship as well, even through COVID. But first of all, let me go actually find out more about your career as a doctor. You work in COVID-19 wards, I understand.
Yeah, no, exactly. So I completed my training and my foundation training in 2016. And ever since the onset of the pandemic, I've spent my times purely on the COVID-19 wards, both on the acute units and also on the more kind of longer term chronic rehabilitation units as well. But no, it's been fascinating.
And also, I'm sure it is challenging because you're seeing a lot since
I think
COVID started.
Absolutely. So it's challenging, but also incredibly stimulating. I think that what's great about medicine is it's an art, right, as much as a science, and it changes so much and so quickly. And since going back to March of last year, March of 2020, when the pandemic first hit and we're in wave one, we knew very, very little about the virus. It was a lot of speculation. It was, we would treat patients based on best practices of similar diseases in the past. And, we didn't know which were the best drugs. We didn't know which were the best, modes of oxygen therapy, but you had to use the basic fundamentals of physiology and science to try things because it was so new. But if I fast forward in time to wave 2 and wave 3, at least here in the UK, we very, very quickly learned what the best modes of therapy was and the best treatments were, right from kind of when patients are unwell at home, when they come into hospital, and when they get into ICU. And it's been, transformative how much medicine has advanced in the space of 12 months for COVID-19. And, I honestly see it as a privilege to have been part of that journey and to have learned so much along the way.
What has changed in terms of therapy? I'm sure with experience now, you know what to take the first few steps. So what has changed and what are the best therapies now?
Yeah, I mean, so it differs depending on what the severity of the virus, you catch and how the body reacts to it. In the early days, around 12 months ago, a lot of the drugs being touted were remdesivir and various other very complicated, expensive specialist drugs. And of course, with expensive drugs like this, there's a lot of hype and hysteria and a lot of excitement because you think, this is the magic bullet. But phenomenally, the most impressive drug and the most impactful drug, which is, has been widely given and costs pennies or bases even per drug, is the common steroid. Dexamethasone is, we use it for many, many things, a lot of respiratory conditions and, a lot of rheumatological and kind of connective tissue conditions, and it's a wonder drug for COVID-19. You know, the thing with COVID is it's not just respiratory, it's also, it creates a lot of clots in the body if things deteriorate, and things like steroids stop that or prevent that from happening. And you know, it's such a simple thing. But of course, you know, 12 months ago, you might say, well, didn't you know that? And the answer is yes, but you have to do things logically. You have to follow the science. You have to have studies and trials and make sure that you don't actually do harm to the patient. Because, you know, on paper, yes, of course, a steroid is exactly the right thing to give, as well as oxygen, as well as potentially antibiotics for, you know, secondary kind of bacterial infections. But you need to be sure, you know, we're dealing with people here. We're not dealing with numbers. And so that's
not just
where
the
we are.
research. Yeah.
No, not just the research. And
Yeah.
it's but what's been great is it's the simple things. And, you know, now when people are sick, they are treated. The vast majority of them get better. That's not to say that it's not a dangerous virus. Of course it is. And of course that, you know, we advocate people should be careful in social interactions, limit them as much as possible, wear face coverings, wash your hands. Don't dismiss them as being basic things, because they're the biggest protectors. And if you have the opportunity to get vaccinated. You know, I challenge you like that. If 12, 13 months ago, we had said there were going to be multiple vaccines that had 90+% efficacy, you know, I would have bit your hand off and said, you know, that sounds like an amazing place to be within 12 months. But here we are. I think the world came together, and it's our job as humans to take them, to not fall for the, you know, misleading kind of glorious headlines that are out there, that are out to kind of scaremonger and have very, very little science behind them, but they sound great. But, you know, science says take vaccines, and, you know, I'm very happy to talk through that in more depth.
That's exactly what I want to ask you about taking vaccine. Of course, there are so many different viewpoints that are going on, and people also have fears. But as you mentioned, it's the only way to get the protection. But there are lots of questions related to that. Number one, what would you like to say about people's fear about vaccinations and blood clots?
Yeah, no, of course. So firstly, when a vaccine is created, some people will say, oh, this one was rushed. But actually, you know, when vaccines need to go through a lot of scientific phases, phase 1, phase 2, phase 3, and beyond. And, you know, in these phases, we have, you know, caseloads of hundreds of thousands of people who check, real people. And only if it's deemed safe and effective does the vaccine go into production. So, you know, the likes of AstraZeneca and Pfizer and BioNTech and various others, they don't just create vaccines for the sake of it. They have to go through a very rigorous process to be able to be allowed to create the vaccines and to be able to distribute them across the world. Regarding blood clots, you know, I alluded to it earlier. COVID is a coagulable disease. It creates blood clots. Your chance of dying or being seriously affected by a blood clot is significantly higher. There are various studies that show, you know, anywhere between 5 to 10 to 20 times more likely to be affected by a blood clot from actually catching the virus than it is from the vaccine.
Right.
And, you know, some people will say, yes, but I don't, you know, I don't have to get COVID, whereas people are telling me I need to get the vaccine. But it's not just blood clots. And, you know, the ones that are in the media regularly for blood clots now, I believe it's the Oxford AstraZeneca one. And there are rumors of the Johnson & Johnson ones, or even some early studies that show that they also have risks of blood clots, but they are tiny. You know, I think the latest study for Oxford and AstraZeneca was something around 10 or 11 per million doses given. I mean, what's the population of Oman? 4 million-ish at the moment, assuming everybody got, and you know, that 11 per million is across the most at-risk age group. So actually the real number is much lower than that. You know, probably the aggregate number is around 4 to 5 people per million. So if the whole of Oman got the vaccine, we're talking 16, 20 blood clots. I challenge anybody to go to the Royal Hospital or SQUH and look at how many patients are in the COVID wards and how many patients are dying every day, and tell me that that risk of 16 people dying across the whole of the country is too much. I don't think anyone would do that.
You got a point. Now, my next question is also the variants, strains, COVID-19 strains that are, being talked about, which according to, and it's increasing, by the way. I think, earlier on we talked about 6 major or 5 major ones, and I'm hearing there are more. What do you think about these variants, and which one is fatal, which doesn't even regard the vaccination you take? At the same time, do you think we would be at one point taking the 3rd dose of a vaccination?
Yeah, no, that's a great question. And look, I'm not a consultant virologist by any means. I'm an acute medicine doctor. I can only tell you what I've experienced and
only your experience, according to
yeah,
you.
no.
Yeah.
So there are a lot of variants, and I think more and more will come. But fundamentally, if you and I pretended to be a virus, there are 2 things that make us good as a virus, amongst others. We can either infect more people, and then our infectivity level goes up, or we can kill more people, and then our death, our severity goes up.
Okay.
But if you start to kill more people, your infectivity decreases because you start to kill your host populations as a virus.
Yeah.
So with these variants, you'll start to see either they are kind of more infective, but are less severe because their trends are to infect more and more people, or they'll become more severe in terms of the illness, but they're less infective because the host dies. Ebola is a great example, very, very deadly, but the numbers were far less than what we're experiencing with COVID-19. Even MERS, the Middle Eastern respiratory virus, was more deadly than infective. And so, it's unlikely that you get something that's more infective and more severe because it doesn't work. The 2 are kind of conflicting. With the variants, I think what's fascinating is most of these variants are actually detected in the UK. And I think the whole world was looking at us here in the UK and thinking, well, why is everything detected in the UK? What are they doing wrong? And being an NHS doctor, I would always fight people and argue back and say, we're not doing anything wrong. And so I looked into this a bit more, and actually, despite the UK having 60, 70 million people as a population, and the NHS is one of the best healthcare systems in the world, and I'll defend that, but the UK actually does nearly 50% of the entire world's genomic testing. So the reason why the UK is detecting all of these variants, the South African variant, the Indian variant, the Kent variant, is because we're looking. So there will be so many more variants out there that are undetected, especially in the countries that have hundreds of thousands of cases a day, looking at the USA, looking at India, looking at Brazil. But because the UK are doing basically half the world's genomic testing and looking for what these variants are, we're picking them up. So there is a real risk with international travel that the UK will be deemed as being the hub of variant creation, but actually it's the hub of variant detection. But in terms of the ones that are out there that are very common, I think we're all looking out for the South African variant here. It's proven to be quite more infective and potentially resistant to some vaccines. But even then, most studies show that all of the modern vaccines are effective against all current variants. And the one that's most common here is the Kent strain. And that's the one that's kind of dominant across the UK. And we know that that's being affected by all vaccines: Pfizer, Moderna, Johnson & Johnson, Novavax, AstraZeneca. So, with the variants, I think more and more will come. I think the world will improve in its ability to create vaccines fast to accommodate for them, which then I think leads me on to the next point, where I would expect next winter and beyond for us to get booster jabs, the 3rd dose of the vaccine.
You think of booster jab?
Yeah, no, almost certainly. I mean, in the UK, we give the flu jab every year.
That's seasonal. Yes.
Exactly, totally seasonal. But again, it's based on variants that are detected in the leading months, etc. With COVID, it's unlikely to be eradicated entirely. More variants will come. We will probably, in my opinion, live in a world where we will all have booster jabs annually to accommodate for most of the common variants, and it'll just be something we live with for a number of years.
Oh, That is a very interesting answer, actually. I didn't go that far. I wasn't imagining that
I
far.
could be wrong, actually.
You've
But
enlightened me. It's better to know and accept and expect, So scientific research is going so ahead with vaccine, and there's almost an international competition that is going on. Is that where we'll be heading? It's going to be a norm. I think some countries are also actually putting the fund, instead of defense and weapons, into research now.
yeah, I mean, the last point you mentioned, I wholeheartedly agree with. I think Bill Gates 10 years ago predicted that, the next World War equivalent impact that would happen to society would be in the form of a vaccine that's resistant to a lot of therapies, and here we are.
Mm.
So yeah, in terms of scientific worldwide research, I think it's great that the whole world are doing it. I mean, you see the US, the UK, Germany, China, and many others creating vaccines. I think that's a great thing. It's not a competition, but what I do want to continue to see is that we're all respecting kind of the global guidelines set by the WHO, that we follow the science and we don't follow the hysteria or any kind of senses of nationalism. All vaccines need to go through a rigorous checking process. And I think as long as every single one that is produced goes through the same one, and kind of learnings are shared across the world as to best practices, then we'll be in a good place. It took us 12 months to create the first vaccine. I'm sure we'll start seeing updated versions of them, within months rather than years.
With us is Dr. Ahmed Shahrabani, and we've been talking all about the medical field and the place where he works, COVID-19 ward in UK. And this has been very enlightening experience. But now let's get back to your topic, and that is the business and the app you came up with. How did you think of the idea, and how has it changed? Because I understand a lot of people are using it.
So Nick, who's the other Locum's co-founder, we were both doctors working in South London in 2000 and, my goodness, 14, 15. And, it was the NHS, we were working in South London, and much like most hospitals across the world, there aren't enough doctors, and most rosters or rotas are short-staffed, and you're asked to cover extra work to fill in the rotas. So it was like clockwork for us. Every Friday, which was the end of our working week, the rota manager would come down and say, Ahmed, Nick, Paddy, Sarah, whoever, can you please work over the weekend because we are short-staffed. We need somebody to cover the wards, because otherwise, a doctor is covering 80 patients instead of 40, and that has its inherent dangers and risks. So if we would say no because we couldn't do it for family reasons or whatever else, they would then go to a recruitment agency, and there'd be a lot of phone calls, a lot of texts, a lot of messages and emails saying, please can you find a doctor for so and so date? I need a cardiologist at 6 a.m. Saturday and Sunday at £40 an hour, for example. But a lot of time was wasted and a lot of money was wasted. The NHS back then spent £4 billion a year on these short-term recruitment, or what we call locum agency doctors, and it wasn't just the money, it was the process took a lot of time, and it wasn't efficient at all. And we looked at other industries in the world, the travel industry, the taxi industry, very simple tech platforms that disintermediated these middlemen. And we basically created an app back then. It was very simple, where if you're a qualified doctor with a license to practice, you could access the app and you could see, based on your specialty and your seniority and your availability, where the NHS needed you. And you could book in directly. So it was very quick, saved money, increased the number of shifts that were filled, de facto increased the number of doctors that could see the patients, and improved patient care ultimately. So that's what we created back then. We've come a really, really long way since then. We're now working with near enough 40,000 doctors, nurses, healthcare assistants, and hundreds of hospitals across the UK. Oh. And it's great. We're very lucky. We've got a great team of kind of engineers, sales experts, operational folk, and yeah, no, it's busy. Our key aim is to kind of improve patient safety and save money and fundamentally improve the working lives of doctors, nurses, and their healthcare workers.
So it wasn't actually a dream and an idea that just came about. You actually took it from the necessity. It was needed. You saw,
Yeah,
you know, a
of
need there,
course.
a vacuum.
Exactly. So we created this out of, as you eloquently put it, the necessity. It was a problem that Nick and I were facing daily. Every other doctor was facing daily, and it was a simple solution. You know, some right place, right time. Tech had come to the level that we needed it to, and yeah, we just rode with it.
As I say, crisis also means opportunity. And now we have so many people involved, it can only grow. Maybe you would go international.
Yeah, potentially. I think you know, it's a universal problem here where the world needs doctors. There is a global shortage of doctors across the world, and you know what we're not creating doctors by this platform, but we're making it easier for them to, we're improving their working lives and also making it easier to fill in the gaps and the rotas, and you know, it's win-win for everybody. So
The accessibility.
Yeah. Yes, exactly.
That would be so interesting, you know, doctors traveling across borders and working wherever there is a need.
Totally. And you
That
know,
would be an ideal world.
medicine is a global language, right? You know, humans are humans wherever they are, and yes, there'll be different disease and patient demographics, but fundamentally a human is a human and a doctor is a doctor. There's nothing more to it, politics aside.
Exactly. Now, where in Oman are you from? And when you're there right now during Ramadan, what do you miss most about?
Yeah, no. So I am. So I'm in London at the moment. But
Yes.
I home is in Muscat in Madinat Qaboos. Went to school at the British school.
Uh,
Um, have really fond memories of that school, and a lot of my kind of teachers back then are now friends. I know Thomas English, I think is still in Oman. We still see each other very regularly, and Dr. Bagheria, I know, was a very kind of close person that made me who I am today. So no, very fond memories of Oman and childhood. In Ramadan, I guess it felt kind of not old school, but authentic. And you know, having been in Muscat in the 90s and the early 2000s, you know, the things I loved about Oman is the people, the friendliness, and life outside of Muscat. You know, there's nothing better than getting a tent, a campfire, and some food, and just going into the middle of the Wahibas or the empty quarter or the mountains and being away from it all. And you know, back then it was empty. And you know, whether things have gotten busier, the new roads, the new buildings, the new schools, the new hotels, new restaurants, blah blah blah. I you know, and that's great to see the country evolve, but you know, a large part of me missed the kind of Arabian authentic feel of things, which I think Ramadan pulls you back into. And it was the late evening tents and the families coming together for iftar. I think people need to be careful now with COVID.
yes.
And
Now we're asked not to do any of that. No tents and no visiting.
And that's totally the right thing to do.
Yeah.
Because a lot of Europe is now kind of on the mend with the wave, and I'm noticing Oman is on the increase with the wave. And the Minister of Health recently said that ITU capacities were at 100%, and people need to absolutely respect that. Have iftar at home. Don't go meet other people. I know it's difficult. I know it's, you know, the time of people mixing together, but we have a pandemic at hand, and in order for us to spend summer together, potentially spend Eid together, you know, having a circuit breaker in the form of 3 remaining weeks of Ramadan is definitely the right thing to do.
Very true. Now, going back to your success story, what according to you is the formula for success? It might sound like a cliche, but actually I know it's hard work, and I'm sure you must have had a formula too.
Yeah, no, I think I think I'm very lucky, and I mean that. I don't think I would be where I am today without my upbringing in Oman. I think the British school, the years I was there, I graduated in 2008, 9, I think. The focus wasn't purely academia. the focus was on creating, global kind of leaders, people who were good with people. And I think that is something that you can't teach. It's something you immerse yourself around. And I think I was very fortunate to have kind of grown up there with, people from all around the world, because that's real life. We live in a world where you meet so many people from different societies and different walks of life, and you need to be able to interact with them in a way where you understand what they like, you understand what is kind of taboo, you understand the right way of dealing with people. Right. And having A's across the board at A level or right the top marks in IB is definitely helpful. But and I ask, so what? There are so many people with top grades. It's just being a good person and being able to listen to people and really empathize with them is what gets people far in life. And that's been, I guess, my formula. I like to really get to know people. And the other stuff comes along. Of course, you have to work hard. Of course, you have to persevere. Of course, you have to get back up if you've been knocked down over and over again. And but it's.
Did you ever feel knocked down?
Oh, actually, plenty of times, almost daily, I'd say. Especially in the early days of building Locum's Nest. We always used to say that there were never any mixed days. It was either a really, really horrible, terrible day where just bad thing after bad thing after bad thing would happen. You just have to sleep it off and wake up the next day and deal with it. Or it'd be an amazing day. And, these peaks and troughs are exhausting, but also exciting. But we believe we were doing the right thing with Locum's Nest. We're not doing this for the money. There are plenty of other ways to make money. But this, impacts people, it impacts the patients, it impacts the healthcare workers, it impacts the healthcare systems. Mm-hmm. And, at the back of our minds, we knew that we're doing the right thing, and therefore you have to get back up and you have to keep going, because if you don't, somebody else with a different agenda who might not do things for the same reasons.
What would you like to advise at young entrepreneurs or potential entrepreneurs?
Yeah, so this is a tricky one. I think it's what I said earlier. It's get your basics, get the academics done, work hard, do that, but do more. You've got to do more. You've got to, I think, for a lot of walks of life, become kind of a people's person. And the other things is just really take it one step at a time. Mm-hmm. Everyone has these amazing goals and visions when they first have an idea for a startup, which is great. But unless you've planned your circuit, every corner you take, and have different milestones along the way, different checkpoints to kind of stop, take a breath, look again, and then go for the next sprint, your chances of success are much, much lower. We would do one of the Locum's Nest kind of key ethics is simplify and re-simplify. And I kind of carry that with everything I do in life. It's always try and keep things simple. The second you try and overcomplicate, nothing happens. It becomes theoretical, it becomes academic, and you need to just keep things practical and simple. So.
No drama. No drama.
Yes, no, exactly. Yes.
So my final question, I know I've taken a lot of your time today, but my final question is just, to think about it. If you were to do a project in Oman, what would it be?
Yeah, no, it's a good question. I think Oman has so much potential. Of course, I would stick in healthcare. That's what I know best. But I really, the people deserve so much in Oman. They're the warmest, kindest kind of people I've ever met in my life, and I'm fortunate to be an Omani as well. I've got so many fond memories of being in the middle of the desert or in the middle of the mountains, no phone signal, nothing. You think you are hidden from the entire world. All you can see are the stars in the sky at night. And all of a sudden you see a local kind of either Bedouin or family pop up, either walking or in like a classic Land Cruiser or an old Nissan. And they'd usually invite you to their tents and you'd have coffee and dates and meet the family. And it's wonderful, wonderful memories. And I think these people deserve a lot. So I want to do a few things in Oman over time. One project we've actually got up and running, I'm working very closely with Ahmed Shahrabani, the GT3 racing champion, phenomenal guy, unbelievable sports person. We're starting a project to tackle childhood obesity in Oman, working with the schools And the reason for that is Oman has a very, very dangerously high incidence of type 2 diabetes in adulthood. And of course, one of the key risk factors is childhood obesity. And I think we're working in kind of very, very innovative digital platform, still in the fundraising cycle. So we're looking for kind of key corporate partners to back us, likes of telecom, oil, etc. So we're trying to get this project underway, and I think it'll really, really impact the country in a good way. That's project one that I'd like to do. And project two is I want to really serve the folk that are living out of Muscat. You know, over 50% of the Omani population live outside of Muscat, yet over 50% of all healthcare provision is in Muscat. And that's no disservice to the kind of organization of the country. That's the same in most countries, very, very similar percentages, ratios in the UK, in London, for example. But it's the likes of the folk in Dhafar and Dakhliya and Nasira, you know, I'd love to kind of have a deeper understanding of what their needs are in healthcare, and provide, because the resources are there. I mean, Mazira, the hospital, is stunning. It is a beautiful, modern hospital. At face value, I just love to kind of find out what the daily needs of the people are there, and just to make sure that the right staff are there, because staff is something that we can help with at Locum's Nest.
With the networking. That's interesting.
Absolutely.
Yes. So if there was a way, we would send you across Omani dates and kahwa, but you know, the situations are the way they are. So I wish you a beautiful holy month of Ramadan, and at the same time, all success to you in the projects, and you know, the projects you mentioned now, your dreams for Oman. At the same time, of course, in your profession as a doctor. I hope you carry this dedication and the spirit throughout. I wish you all the best.
Thank you, and hope to see you soon back in Muscat whenever I'm next back.
Okay, good. Let us know.